Hello and welcome back to my YouTube channel. I'm so delighted to be here and to have you on my channel. Thank you for stopping by. Today is about dairy and prostate health. This video is to enlighten men about prostate health or dysfunction, as it seems that the population of men with this dysfunction is increasing every day. Years ago, after finding out that I can get my calcium from vegetables like kale without drinking dairy, and therefore getting antibiotics and steroids to my system, I reduced my dairy and milk intake because of the association. So the higher the consumption, the higher the risk of developing prostate cancer for men. Research now shows that an association is stronger for advanced or fatal prostate cancer, and there is a dose-related response and relationship. So the higher the milk intake or dairy intake, the higher the risk of developing prostate cancer, especially if you are consuming 2 to 3 servings in a day. Dairy consumption has been studied for its potential link to poorer prostate health men, particularly the risk and progression of prostate cancer. Some research has shown that higher total dairy intake, especially milk, is associated with modestly increased risk of developing prostate cancer. Wow. This association is stronger for advanced prostate cancer, and it's also dose related. The higher the intake of dairy, the higher the risk of developing. If you are taking 2 to 3 portions or servings of milk a day, it can affect it. So, however, the relationship is complex, but several biological mechanisms have been proposed. Here are the main ways dairy may negatively influence prostate health. Let's take a look. There can be an increase in the amount of concentration of what you call the IGF, a growth hormone in the body. Milk naturally contains compounds that stimulate this insulin-like growth hormone 1 called IGF-1. So higher IGF-1 levels are associated with increased cell growth and reduced cell death. That's dangerous. This is in prostate tissue. This can lead to increased proliferation of prostate cells, greater risk of abnormal cell growth. 3, potential acceleration of tumor or cancer development. Also, studies show that men with these higher levels circulating have a higher risk of developing aggressive prostate cancer. Now, if there's a family history, then dairy should be avoided. Prevention is always better than cure. 2, hormones can be present in milk naturally and unnaturally. A lot of cows, especially those raised in the Western world, are injected with steroids and antibiotics. And these steroids and antibiotics will be present in the milk. And these steroids are hormones which will affect the prostate. So most of these cows are brought that aren't grass-fed or raised organically or not well pastures and packed together in stalls will carry these things. So they fall ill and are injected with steroids or fattening and antibiotics because of disease. Also, milk from pregnant cows contains natural hormones such as estrogens, progesterone, and androgen precursors. Now, these hormones may influence hormone-sensitive tissues like that of the prostate. So, an excess hormonal exposure can potentially stimulate prostate cell growth. Number 3, there can be calcium overload and vitamin D suppression. High dairy intake often leads to very high calcium levels in your blood. And excess calcium may now suppress and reduce the amount of active vitamin D in your bloodstream, as it is needed by calcium for its absorption. This now reduces vitamin D's protective effects against abnormal prostate cell growth. I hope you're hearing me. So, low vitamin D activity is associated with a higher risk of prostate cancer and progression of prostate cancer. The 4th way is saturated fat and inflammation. Many dairy products like cheese, whole milk, and butter contain high levels of saturated fat. It's a known fact. And this can contribute to what you call chronic inflammation, metabolic dysfunction, oxidative stress is increased. Now, these conditions create an environment that supports cancer development. Number 5, possible insulin resistance. I've talked about insulin resistance before. Frequent dairy intake, especially sweetened dairy products, may contribute to what you call metabolic dysfunction and insulin resistance, which are linked with higher cancer risk and worse outcomes in prostate cancer people that already have it. Now, research generally shows that A higher dairy intake, this is just a summary, especially milk, is associated with higher prostate cancer risk. One, fermented dairy like yogurt and kefir appears to be less negative with this association. It has less negative, it has a less impact. Risk also appears to be dose dependent. So the more dairy you consume, the more it can affect you. So let's look at guidance for prostate health. Many functional medicine practitioners recommend the following, and I agree with them from the bottom of my heart. Reduce or limit cow's milk. I have done that. Reduce consumption of cheese. I don't even like cheese. Reduce your consumption of ice cream. I rarely have ice cream. Reduce high calcium dairy intake. Better alternatives include unsweetened plant-based milk or nut milk like almond milk, unsweetened coconut milk, hemp milk, and fermented foods instead of dairy probiotics. So if you want to have probiotics, go for, non-dairy probiotics. However, make sure that the ones you buy in these stores are at least 90% of the active ingredient, because most of the ones that you are buying have less than that in them. So a balanced perspective is that dairy does not automatically cause prostate cancer, but evidence suggests that high intake may increase the risk or the progression, particularly in men who are already predisposed to prostate cancer. Do feel free to ask questions in the comment section and I will respond to you. And I will catch you in my next video. I hope this has been of value to you. Please share and subscribe to my channel.